I'm Beverly Kirk, director of the CSIS Ideas Lab, here with Dr. Victor Cha. He is a senior advisor and Korea chair, and he's one of the authors of a new report on the changing landscape of global health diplomacy, and you write about South Korea. Thanks so much for being here.
It's my pleasure.
How active has South Korea been in the area of global public health?
Beverly, they've been quite active. There are, I guess, a few things to highlight. The first is that they signed a major MOU, Memorandum of Understanding, with the United States in 2011 on coordinating development assistance policies, which a major component of which includes health assistance. So that's cooperation with the United States. In addition to that, South Korea on its own has been quite active in Africa, particularly in places like Ghana, where they have a waterborne disease control program, as well as in the Congo, where they have a large multi-million-dollar immunization program. They've also been very active in Latin America and in Southeast Asia in terms of building hospitals in Laos, Cambodia, and some other places. So quite active.
What accounts for this broader interest?
I think part of it connects to Korea's desire to be more of a global player in general. Traditionally, Korea has been very much of a regional and a peninsular player, focused on issues closer to home. But as they become an OECD country and have become a very affluent country, they're very much interested in providing public goods to the international system. Korea, as you know, is the first country in modern history that went from being a net donor or recipient of aid to becoming a net provider of aid. They are the only OECD country that is increasing ODA assistance, and they have a Peace Corps program, the equivalent to our Peace Corps program in the United States, that is second largest in the world, only to the United States. So it's part of this global Korea platform.
And how are these global health priorities impacted by their neighbor to the north, North Korea?
Right. So every time people talk about Korea, they always hear about North Korea. And I think in many ways, what's so interesting about the global health part is that it shows, one, that Korea is trying to step out of simply this one problem of North Korea. And secondly, it's not going to allow some of these issues on the peninsula to stop them from being a global player. They separate these two things both in their minds and in their policies. ODA and health assistance that is budgeted for South Korea does not include what they do with North Korea. That comes from a different unification ministry budget. So I guess the bottom line is it's still a problem. The nuclear weapons are still a problem, but it's not going to prevent Korea from doing other things that help provide public goods for the international system.
Dr. Victor Cha, thank you so much.
My pleasure.